News Center Maine is partnering with the Maine-Monitor to bring you some of the reporting being done by journalists at the nonprofit independent publication. We'll be featuring one of their stories each Monday. Today, we're talking about our aging population. Maine lawmakers are considering two bills that would provide funding to support older Mainers living alone and living in veterans homes. Rose Lundy is a senior public health reporter with the Maine-Monitor. She just published a new story on the legislation. Rose, thanks so much for being with us again.
Thank you for having me.
All right, let's jump into this. The first bill you talk about is LD 182. It would change reimbursement rates under Maine Care to establish sort of an ongoing annual funding for Maine Veterans Homes. So why are advocates calling for this funding?
Yeah, I think, first of all, it's important to know that Maine Veterans Homes are kind of a unique group of facilities. They are a nonprofit entity, but they're separate from the VA, but they do get federal funding. And so as a result, they do have some higher occupancy and care standards that they have to adhere to, including higher staffing ratios. And so, and it's also required in state law that they stay open. So there's some extra kind of pressures that their CEO talked about, how they have higher demands, and as a result they have had annual deficits of more than $8 million annually. And so this bill would change the reimbursement to be on a per resident daily basis, which would essentially create a baseline funding for those facilities.
There has been some pushback on the bill. What are some of the concerns you've been hearing?
Yes, so the state is actually opposed to the measure for a couple of reasons. First and foremost, the state just finished a long process to overhaul the rate methodology for nursing homes in Maine. And so they said that would have been a great time to collaborate with the Veterans Homes and kind of hear this proposal and these concerns. And they also talked about how this change would essentially create a different methodology for veterans homes from other nursing homes, and so it would create an inequitable standard for those between the two.
So you also talk about the other bill that's highlighted in your story, LD 814, which would provide nearly $10 million in annual funding to Maine's 5 area agencies on aging. So how would that money be used exactly?
Yeah, so this bill, proponents are calling the Older Mainers Act. So, as you said, it would provide ongoing funding for the area agencies on aging. Primarily, it would eliminate the wait list for Meals on Wheels, which is significant right now, and it also would expand services such as case management and Medicare counseling. So it was a bipartisan bill, and it was unanimously voted out of the Health and Human Services Committee, so there was a lot of support for it. And one of the lawmakers actually said that it's a good example of a return on your investment. You get a lot for what you're paying for it. So now it'll go to the full legislature, and we'll see if it moves forward.
It can always be tough to sift through the weeds of funding in the legislature, so good on you for piecing it all together.
Thank you.
Rose, thanks so much for coming back in and talking with us.
Thank you for having me.
And you can read the full story and much more at the maine-monitor.org.